Now we're going to perform a treatment in this area that we marked off. I'll always start with either the top or bottom. Just find an area that you always consider your beginning point. And I apply adequate amount of gel, about the size of the area that you're treating. And we've got the cartridge selected here. It's a 0.9. And what I like to do is put my hand underneath the thigh and just push up into the thigh just to help squeeze a little bit of fat that may be falling down back into the area. What you don't want to do is press really hard down into the leg, or else you're going to squeeze the fat out and you're not going to have the thickness to work with. So I usually just put my hand here, or sometimes I might even take a towel and I'll roll it up into this area, and if I just have you lift up a little bit and then settle down in the towel. Now the towel helps push up without my hand and allow me to be free. So I'll do that a lot of times when working with the inner thighs or the outer thighs. And we've got the gel on there. We're ready to go. The machine is set. And I'm going to start at the top of one of my quadrants and simply just start working my way down 1 millimeter at a time. Remember, we're going to perform 25 shots per block in one direction, the vertical direction, up and down. And then we're going to perform the same amount of shots, 25 shots in the horizontal direction in each box or each quadrant that we've marked. And as you can see, my cartridge is getting down to the layer, the next block. I'm still not there because the edge of the cartridge hasn't gotten to that line. Once I get to that line, I just start working my way back up until the 25 shots are over, and then I move to the next quadrant. So I'll move down and then I'll move back up the quadrant. Always keeping the head on the skin, and if the gel doesn't seem to be a lot of gel there, just pause it. You can get more gel into the area and then go. So we went vertical direction. Now we'll position ourselves to go in the horizontal direction. And again, as a practitioner, it's better for you to get comfortable in the position you're going to be in. So make sure that when you position them, you're able to hold the handle and manipulate it and still be able to get an adequate amount of fat push up in the area and access those quadrants. So I start on the outside of the quadrant and just start working my way across with the 25 shots in one direction, moving 1 millimeter or 2 at a time until you get to the edge of the end of the quadrant. And then we work our way backward, going in the same direction, horizontal position, but opposite direction. So now that we're getting kind of toward the edge of this quadrant, what I like to do is just pause it for a second and make sure I get gel back on the head of the HIFU cartridge, and then just continue the process. Once I get to the edge, I just start working my way back, just to make sure we're getting adequate coverage of that whole quadrant that we just worked on, in the vertical position and in the horizontal position. Now obviously I would be working each quadrant in one direction, so I would have been doing the first quadrant in the vertical direction, and then I would have moved to the next quadrant and all of them done in the vertical direction, and then I'd start over in the horizontal direction. And as you're doing this, you're just assessing for heat. As you move the gel from one quadrant to the next, assess for some heat and assess for the redness or pinkness. Using a deeper cartridge, don't expect to see a lot of redness. If you do, it's okay. It just doesn't want it to be too severe. But you might even feel some heat coming up, and again, listening to their subjective opinion about how they're feeling to adjust the power setting on your machine.